Hey everyone, welcome back to the channel. Today, we're diving into a topic that's incredibly personal to me, and I know to millions of you out there, managing type 2 diabetes. The title of this video is Control Type 2 Diabetes, Naturally No Meds Needed. And while that sounds like a bold claim, for many, it's an achievable reality through dedicated lifestyle changes. I want to be crystal clear from the very beginning. I'm an experienced diabetic patient, not a doctor. My journey has been filled with trial and error, learning what works for my body, and reclaiming a sense of control over my health. I'm here to share the strategies that have made a profound difference for me, in the hopes that they might offer you a roadmap for your own journey. Before we get into the specifics, it is absolutely crucial that you always consult your healthcare provider before making any changes to your diet, exercise routine, or overall management plan. Your doctor understands your unique medical history and can provide personalized advice that is safe and effective for you. Think of me as a fellow traveler on this path, sharing my map and experiences. My goal is to empower you with knowledge and motivation, so you can have more informed conversations with your healthcare team and take proactive steps toward a healthier life. This is about building a community of support and shared learning. So, if you're ready to explore how powerful, consistent lifestyle adjustments can be in the fight against type 2 diabetes, you're in the right place. We're going to break it down step by step into practical, actionable strategies. This isn't about a quick fix, it's about building a sustainable, healthier future. If this sounds like the kind of content that can help you or someone you know, please take a moment to like this video, share it with others who might benefit, and subscribe to my channel. Your support helps us grow this community and reach more people who need it. Now, let's get started. Alright, let's start with the absolute cornerstone of diabetes management: what you put on your plate. Adopting a balanced, low glycemic diet sounds complicated, but the principle is simple. We're focusing on whole, unprocessed foods, things that look like they came from a farm, not a factory. Think vibrant vegetables, lean proteins like chicken and fish, healthy fats from avocados and nuts, and complex carbohydrates like quinoa and sweet potatoes. The key is to limit or avoid refined carbs, the white bread, sugary cereals, and pastries that cause rapid spikes in your blood sugar. It's not about deprivation, it's about making smarter swaps that keep your energy levels stable and your body happy. A great visual tool I use every single day is the plate method. Imagine your plate is divided. Fill half of it with non-starchy vegetables, broccoli, spinach, bell peppers, you name it. They're packed with fiber and nutrients but low in carbs. Fill 1/4 of your plate with a lean protein source. This helps with satiety, keeping you full and satisfied. The final quarter is for your complex carbohydrates. This built-in portion control helps you get the right balance of macronutrients without having to obsessively count every single calorie. It's a sustainable framework for eating that puts you in control of your blood sugar response after every meal. Now let's talk about something that works hand in hand with diet: managing your weight. For many people with type 2 diabetes, carrying excess weight, especially around the abdomen, can increase insulin resistance. This means your body's cells don't respond as well to the insulin you produce, making it harder to control blood sugar. The good news is that you don't need to achieve some unrealistic ideal weight to see massive benefits. Research has shown that losing even a modest 5 to 10% of your total body weight can dramatically improve insulin sensitivity, lower your A1C, and reduce your need for medication. So, how do we do it? It's a two-pronged attack, combining the calorie moderation we get from our balanced diet with increased physical activity. It's not about crash dieting, which is unsustainable and often leads to rebound weight gain. Instead, it's about creating a small, consistent calorie deficit. By making smarter food choices and moving your body more, you start to gently tip the scales in your favor. This gradual approach is not only more effective for long-term weight management, but also much kinder to your body and mind. It's about building healthy habits that last a lifetime, not just for a few weeks. If diet is the foundation, exercise is the supercharger for your diabetes management plan. When you're active, your muscles use glucose for energy, which directly helps to lower your blood sugar levels. It also makes your body's cells more sensitive to insulin, so the insulin you do have works more efficiently. The official recommendation is to aim for at least 150 minutes of moderate intensity aerobic activity per week. That breaks down to just 30 minutes, 5 days a week. This could be a brisk walk, a bike ride, swimming, or even dancing around your living room. The key is to get your heart rate up and break a light sweat. But don't stop with cardio. Adding strength training 2 to 3 times a week is a game changer. Building muscle is like creating more storage depots for glucose in your body. The more muscle mass you have, the more places your body can stash away sugar from your bloodstream, preventing it from building up to dangerous levels. This doesn't mean you have to become a bodybuilder. Using resistance bands, lifting light weights, or even doing bodyweight exercises like squats and push-ups can build functional strength that significantly improves your metabolic health. Find activities you genuinely enjoy, because consistency is everything. You can't manage what you don't measure. This is where your blood glucose meter or glucometer becomes your most important tool. It's kind of like the dashboard of your car, giving you real-time feedback on how your body is responding to your food, exercise, and lifestyle choices. Regularly testing your blood sugar is non-negotiable if you're serious about managing diabetes without medication. I recommend tracking your numbers at key times. First thing in the morning for your fasting glucose, and then 1 to 2 hours after your main meals to see your post-meal or postprandial response. This data is pure gold. Keeping a log of these numbers, either in a notebook or a smartphone app, allows you to see patterns emerge. Did that bowl of oatmeal for breakfast cause a bigger spike than you expected? Did that evening walk help bring your post-dinner numbers down into the target range? This information empowers you to make small, immediate adjustments. Maybe you need a smaller portion of oatmeal next time, or you make sure to always take a walk after dinner. By staying within the target range your doctor sets for you, you're actively preventing the long-term damage that high blood sugar can cause. This next one is something people often overlook, but it's critically important: managing stress. When you're under chronic stress, your body goes into fight or flight mode. It releases stress hormones like cortisol and adrenaline, which are designed to give you a quick burst of energy to deal with a threat. To do this, they signal your liver to release stored glucose into your bloodstream. If you're constantly stressed from work, family, or just life, your body is constantly dumping sugar into your system, making it incredibly difficult to keep your blood sugar levels under control, no matter how well you eat or exercise. So, how do we combat this? By intentionally building relaxation into our daily routine. This isn't about eliminating all stress, that's impossible, but about managing our response to it. Simple techniques can make a world of difference. Deep breathing exercises, where you focus on slow, deliberate breaths, can calm your nervous system in minutes. A daily meditation practice, even just for 5 or 10 minutes using an app, can lower cortisol levels over time. Or maybe for you, it's gentle yoga, listening to calming music, or spending time in nature. Find what works for you and make it a non-negotiable part of your day. Let's talk about something we all do, but many of us don't do well enough: sleep. Getting enough high-quality sleep is not a luxury, it's a metabolic necessity. When you're sleep deprived, your body's hormonal balance gets thrown completely out of whack. Studies show that even just 1 or 2 nights of poor sleep can decrease your insulin sensitivity, meaning your body needs to work harder to process sugar. It's actually pretty similar to the effect of chronic stress. Your body becomes less efficient at managing blood glucose simply because it hasn't had the chance to rest and repair properly. Furthermore, lack of sleep messes with your appetite-regulating hormones. It increases ghrelin, the hunger hormone, making you crave high-carb, sugary foods. At the same time, it decreases leptin, the satiety hormone, so you don't feel full even after eating. This is a disastrous combination for anyone trying to manage their weight and blood sugar. Aiming for a consistent 7 to 9 hours of quality sleep per night is one of the most powerful things you can do for your health. Create a relaxing bedtime routine. Make your bedroom dark and cool, and avoid screens before bed to give your body the restorative rest it needs. This next tip is so simple, yet so effective. Stay hydrated. And specifically, I mean with water. Your blood is mostly water, and when you become dehydrated, the concentration of glucose in your blood increases. Your kidneys also play a crucial role in flushing out excess sugar through urine, and they need plenty of water to do their job efficiently. When you don't drink enough, your kidneys work harder, and your blood sugar can creep up. Making water your primary beverage is a simple habit that supports your body's natural blood sugar regulation systems. The goal for most people is to aim for around 8 to 10 cups of water per day, but this can vary based on your activity level and climate. The most important part of this strategy is what you're not drinking. Sugary drinks like soda, sweetened iced tea, fruit juice, and fancy coffee drinks are just liquid sugar. They provide a massive rapid dose of glucose with no nutritional value, causing huge spikes in blood sugar that are incredibly difficult for your body to handle. By simply swapping these sugary beverages for water, you are eliminating a major source of uncontrolled sugar from your diet. Now let's have a tough but necessary conversation about two lifestyle habits that can really sabotage your efforts: alcohol and smoking. Let's start with alcohol. It has a pretty complex relationship with blood sugar. At first, some alcoholic drinks, especially those sugary cocktails or beer, can raise your blood sugar. But then, your liver actually prioritizes metabolizing alcohol over its other jobs, including releasing glucose. This can lead to a dangerous drop in blood sugar or hypoglycemia several hours after drinking. Alcohol also contains empty calories, can impair your judgment about food choices, and can interfere with diabetes medications if you're on them. So, if you choose to drink, moderation is key, and always check with your doctor. Now, smoking is even more straightforward. It is just terrible for diabetes management. Nicotine actually increases your blood sugar levels and makes your body more insulin resistant. People with diabetes who smoke have a much harder time controlling their condition and are at a significantly higher risk for all of the serious complications of diabetes, including heart disease, kidney failure, nerve damage, and circulation problems that can lead to amputation. If you smoke, quitting is arguably the single most important step you can take for your long-term health. Please work with your healthcare team to find a cessation program that works for you. Okay, let's discuss a more advanced strategy that's gained a lot of popularity: intermittent fasting. It's important to say right up front that this is not for everyone, and really does require medical supervision. Intermittent fasting isn't about what you eat, but you eat. The most common approach is called time-restricted eating, where you consume all your meals within a specific window, like, for example, 8 hours, and fast for the remaining 16 hours of the day. For instance, you might eat only between 12 p.m. and 8 p.m. This gives your body a long, extended break from digesting food. The potential benefits for some people with type 2 diabetes include improved insulin sensitivity, weight loss, and better blood sugar control. By giving your pancreas a long rest from having to produce insulin, it can potentially become more responsive when it's needed. However, there are also risks, especially the danger of hypoglycemia or low blood sugar, particularly if you're on certain medications. This is why it is absolutely essential to consult your doctor before trying any form of fasting. They can help you figure out if it's a safe and appropriate strategy for you, and guide you on how to do it without compromising your health. Finally, even if you're successfully managing your diabetes with lifestyle changes and without medication, you are not on this journey alone. It's vital to continue with regular checkups and work closely with your healthcare team. Managing diabetes is more than just keeping your daily blood sugar numbers in check. Your team will monitor key long-term health markers that give a bigger picture of how you're doing. This includes your A1C, which shows your average blood sugar over the past 3 months, as well as your blood pressure and cholesterol levels. Think of your doctor, and maybe a dietitian or a diabetes educator, as your coaching staff. They can help you interpret your data, celebrate your successes, and troubleshoot challenges. They can see trends you might miss and make sure you're not developing any underlying complications. Being off medication doesn't mean being off the grid from a medical perspective. These regular checkups are your insurance policy, confirming that your natural approach is working effectively and keeping you safe for the long haul. This proactive partnership is really the key to sustainable long-term success. We've covered a lot of ground today, from the food on your plate to the quality of your sleep. I hope you can see that you have an incredible amount of power to influence your health. The key takeaway from all of this is that success depends on consistency and tailoring these strategies to your body's unique response. What works perfectly for me might need a little tweaking for you. That's why monitoring your numbers and listening to your body is so important. This isn't about a 30-day challenge. It's about building a new lifestyle, one healthy habit at a time. Be patient and compassionate with yourself. There will be good days and bad days, but every step in the right direction is a victory. Now, I need to be very direct about this next point. For some individuals, despite their best efforts with diet and exercise, lifestyle changes alone may not be enough to get their blood sugar into a safe range. And that's okay. The ultimate goal is to protect your health. If lifestyle changes aren't enough, medication may be necessary to prevent serious long-term complications like heart disease, nerve damage, and kidney disease. There is no shame in needing medication. The only failure is not doing what's necessary to stay healthy. Always follow the guidance of your medical team. To close, I want to repeat my most important message one last time. I am an experienced diabetic patient, not a doctor. Please take advice from your doctor. Use this video as inspiration and a source of ideas to discuss with them. Thank you so much for spending this time with me today. If you found this information valuable, please help me grow our supportive community by hitting that like button, sharing this video with someone who needs to hear it, and subscribing to my channel for more content on living a healthy, empowered life. Stay healthy, and I'll see you in the next video.